When most people hear about MRI scans, they think of advanced medical technology, powerful magnetic field, and life-saving diagnosis. But for some patients, stepping inside that narrow tube brings on something very different. Fear. Claustrophobia is the intense fear of enclosed spaces. While not everyone experiences it, research done by L.C. Kilborn suggests that between 5 to 10% of patients struggle to complete an MRI scan because of this fear. For them, the long, narrow tunnel of the scanner can feel less like a medical machine and more like a trap. The source of the fear is easy to understand. An MRI scanner is essentially a confined tube. Patients are asked to lie completely still for 15 minutes or more. The inability to move freely, the lack of natural light, and the machine's loud knocking noises, it becomes a stressful environment for anyone who feels uncomfortable in tight spaces. For a claustrophobic patient, the experience can trigger both physical and emotional responses. Physically, they may feel their heart racing, palms sweating, or difficulty breathing. Emotionally, panic can set in. The feeling of being trapped, the fear of suffocation, or the overwhelming urge to get out immediately. Healthcare teams recognize this problem and work hard to support patients. Other strategies can make a big difference. Patients are often given headphones to listen to music, or earplugs to soften the noise. Mirrors or prism glasses allow them to see outside the scanner, creating a sense of space. And constant communication with the technologist, knowing they can talk and be heard, gives reassurance and comfort. Also telling the patients about the emergency buzzer. Relaxation techniques during preparation also plays an important role. Deep breathing exercises, guided imagery, or focusing on positive thoughts can calm the body and mind during the scan. Some hospitals even use video goggles to project calming scenes, helping the patient imagine they're somewhere else. In more severe cases, medication can help. Mild sedatives allow the patient to stay calm long enough to complete the test. This ensures doctors still get the crucial images they need for diagnosis, without putting the patient under unnecessary stress. Technologically, there is the use of open MRI machines. Unlike traditional scanners, these designs are wider and less confining, which helps reduce feelings of entrapment. However, open MRI machines are not always available, and they may not provide the same image quality as closed ones. Claustrophobia in MRI is not just a fear, it is a real medical barrier. But with understanding the patient, patience in communicating, and coping strategies, patients don't need to miss out on life-saving scans. Technology and care together make it possible to turn what once felt like a frightening experience into one that is safe, manageable, and even reassuring.